And then I also find another as a contrast for differential diagnosis. This one is ALHE, angiolympoid hyperplasia with eosinophil, aka epithelioid hemangioma. So you can see this proliferation of this red ridge of blood vessel nodule usually happen in the head and neck area. As the name you already know, eosinophil. So for a classic lesion, it's kind of a dermal nodule. And even in low power, you can see tons of inflammatory cells, almost forming a germinal center. If you can see truly germinal center, there's another disease called Chimera disease. The microscopic features are identical to ALHE. But when you zoom in, other than this lymphocyte proliferation, you usually will see tons of these cells, eosinophil, tons of eosinophil inside. So you may just thinking, oh, could it be ALHE? And then you need to find other feature. In ALHE, usually also see a big vessel, and then around the big vessel, not like pyogenic granuloma, you can see tons of this spindle endothelial cell proliferation. But the blood channel, because this endothelial cell just really poor differentiated, they just could not forming I could not say really poor differentiated. It just like it's not mature endothelial cell. They just could not forming a blood vessel with a lumen you can recognize. But if you see the detail, you can see they still try to forming a lumen around. And then this endothelial cell kind of plump. They kind of bigger, fatty plump than the normal endothelial cell. Just like all the blood vessel lumen kind of compact together. You just could not find the lumen. So when you see this big blood vessel lumen, eosinophil, and then around you can see this spindle cell proliferation. They try hard to forming a lumen, but just get kind of gets squeezed by other collagen or other structure around. They just could not have a mature blood vessel that is ALHE, aka epithelioid hemangioma. So inflammatory cell, big vessel, and then the small slit-like vessel around. This is another ALHE. Low power, you can see tons of inflammatory cell, at least lymphocytes in this lesion, and then some blood vessel. Then when you zoom in, not only the blood vessel caused red, tons of eosinophil. See, in this area is so many eosinophil. When you see this eosinophil, you just would like to thinking this ALHE, and then find a big dilated blood vessel, and then find some vessel around. They're trying to forming this lumen, but they are just really good at their job, kind of immature proliferation of this endothelial cell. See, and then the endothelial cell cytology kind of plumps. They looks bigger, not like the regular endothelial cell. So this case is really classic. Big vessel, small vessel, try to forming this small vessel lumen, but they are not really good. And then with this plump endothelial cell, tons of eosinophil. This is another one. I think this one from the path presenter, they call it ALHE, but when you see tons of these germinal center, also suspicious for Chimera disease. But as I say, usually the histology findings are really identical. Maybe we need some clinical picture. So let's zoom in to find our friends tons of eosinophil. Everywhere is red. And then kind of a big vessel. And then surround the big vessel, we have this plum endothelial cell proliferation everywhere. Endothelial cell proliferation and look plum, the cytology, ALHE.